Welcome to Feminist Utopia, a community dedicated to envisioning and creating a more just society for all. Welcome to Feminist Utopia. This week, in honor of September being Pain Awareness Month, we're going to be talking about opioid use. And in our Feminist Utopia, pharmaceutical companies actually work to help patients rather than hurt them. And the effects of opioids on women are recognized and dealt with.
Well, I think we've all heard about the opioid crisis. It is in every topic. In Seattle, we talk about it in regards to the people living on the street. You see it with kids dying in rural America. You see it in newspapers talking about OxyContin.
One thing that surprised me is the accidental drug overdose is now the leading cause of death in the U.S. among those under 50. So it's greater than cancer or anything else.
And this has contributed to the overall statistic that people are living shorter lives because we are losing so many young people in such greater numbers. Estimated 130 Americans die from overdoses every single day. And those numbers are from 2 years ago. It's probably higher now.
It's really difficult to wrap your brain around the extent of the problem. And it really does affect all age groups, all ethnicities, every area of the country as far as geography and all socioeconomic status levels. It's just ubiquitous. I don't feel like it's getting enough attention and not enough is being done.
That really surprises me given the predominant white nature of the opioid deaths. At least I'm seeing in Seattle, but it's primarily a white city, so maybe that's it. But it's the way you see it in Alabama, the way you see it in rural Louisiana, the way you see it in Iowa, the way you see it in Nebraska. It is common in our white patriarchal society to respond more energetically when white people are in trouble. The crack epidemic in the 80s was viewed as a black problem.
Right.
And so what did we do? We allied with the narcos and brought in more. Our government did. Because they were funding the Sandinistas in Nicaragua, and then they sold arms. There's lots of stuff out there. Go back and read the 80s. But basically, we knew there was a drug crisis, partially manufactured, and it was viewed as primarily poor and black. So we created these horrible consequences to being an addict to crack and drugs like that because it was primarily a black thing. And we haven't seen a response to criminalize it the same way with this opioid crisis.
Right.
It's hard to get worked up about Purdue Pharmaceuticals being a criminal in spite of companies being people.
Oh, exactly. It really is easier to get so worked up about the young African-American men on the street corner selling crack than it is big pharma.
Yes.
But push pills they do.
Yes.
It is insane. And one of the things that we are finding is that women are experiencing increases of use and overdose at a faster rate than men. There's some serious differences in the way men and women are affected by this crisis. Women get 2/3 or 65% of all U.S. opioid prescriptions, which really surprised me, given the fact that a lot of times women's pain isn't recognized and is diminished. And so you have this dichotomy of women not being believed for their pain, and then when they are believed, really overprescribed.
And it's prescribed for chronic conditions for women. There was an encampment not too far from my house. I would take garbage bags over so they could clean up after themselves. And they were almost all heroin users using needles. The women I spoke to invariably started with opioids. One woman had lupus, one woman had endometriosis. And then the problem is endometriosis and lupus are chronic illnesses.
Right.
because we haven't done the research on endometriosis to learn how to effectively treat it and remove the pain. So the idea is you've got this pain. And so what happened is these women would get addicted to these pills. Then the doctor would say, you're addicted, so I'm taking them away. And then they're left with this lupus pain or endometriosis pain. And so they turn to heroin and their lives further spiral out of control.
Yeah, it's real pain and not well understood.
Yes.
And I don't think it's taken seriously. Like you said, if there was more research, we might be having a different conversation if we could get a cure. But really, the results are devastating. Women's mortality rates from opioid overdose increased over 500% between 1999 and 2016. There was an increase for men, but it was 321%. Those numbers are staggering, but 500% in less than 15 years.
That's a lot in a short amount of time.
I think every family is touched by this.
Yes.
You either know someone personally or a friend, or you see it on the streets. I don't think there's anybody anywhere that hasn't been affected by the crisis in some way.
It's interesting, even my kids here, because it's summer, people would wear flip-flops, but we now have a no open shoe policy because, especially if we walk past this encampment area, there are needles. They leave them on the ground.
But I've also seen sharps containers everywhere around your house.
Well, they got rid of that sharps container in that little park because most places where they have disposal containers like that, they're in front of fire stations or mental health facilities. In my community, they put it in a park. It was isolated, so what was happening is addicts were ripping open the box, trying to find needles with a little bit of drugs still left in them.
How desperate must you be?
And to the point where right now in my part of town, there's a Hep C and HIV outbreaks.
Wow.
From the rampant needle sharing. So now even my kids, and they're mostly grown up, but we had to have a very real talk about sharps and exposure without criminalizing or trying to demean these people that are literally driven by their addiction. The encampments near our house, which are considered, quote, safe, I'd say easily there are more women than men.
Wow. That's kind of scary. When you take this huge problem and realize that there aren't that many treatment programs.
There aren't.
And the treatment programs that are out there, less than half of them provide special programs or groups tailored to women's needs. I mean, they need childcare, trauma therapy, and it's incredibly hard to find a place that offers that. And only 21% offer programs or groups for pregnant or postpartum women, and that's when they're at their most vulnerable.
When their lives could maybe be turned around. And I think part of it goes back to addiction research, which has been primarily done on men. We hold to outdated models, and I'm going to smack talk AA here a little bit, this idea that you can just grit your teeth and get through it. You really can't with opioids. Medically assisted treatment, MAT, has been proven to be successful over and over and over again. And women get less access to it.
Right. And there's all kinds of things about AA. It's not even a scientifically proven successful program.
Yes. And I want to be more specific, NA, Narcotics Anonymous, as opposed to AA, but it's the same model.
Oh, yeah.
The idea that you can just translate alcohol addiction to opioid addiction is not based in anything resembling research or knowledge.
Right. And the research that we do have shows that there are significant gender differences in the prevalence rates, in the health service utilization, and in the treatment outcomes. And on top of that, the physiological consequences of alcohol and drug consumption. All of these things are different for women. Women progress from use to dependence more quickly than men. They often suffer more severe emotional and physical consequences of drug use as compared to men. And yet again, they underutilize the treatment.
I've been doing some research for this show. I was trying to find an addiction treatment program in my area that specifically worked with women. And I found a few that worked with men, but I found none that worked specifically with women, meaning no child care assistance, no trauma therapy, no people knowledgeable about domestic violence. There's so many addiction issues. Also, the physical effects that they have after suffering addiction. Liver damage happens so much faster in women. So what happens is they get into a treatment program, hooray, and then they relapse at much higher rates.
Yeah. So let's try and find some hope in all of this. One of the things, we do have a voice with our vote, and we have an election coming up in 2020. So I thought it'd be interesting for us to take a look at where our candidates stand on opioid addiction and treatment and the crisis. In my feminist utopia, Elizabeth Warren is president, and we're focusing on the female candidates, basically. Although the plans vary on specifics, a lot of them have some common features. Almost all the candidates have stated publicly that the pharmaceutical industry must be held accountable for its role in the opioid epidemic, and we're seeing that now. There have been some decisions that have come down. There was a landmark $270 million opioid lawsuit settlement recently for Purdue Pharma.
Or was that Johnson & Johnson?
Well, Purdue Pharma, in what I'm looking at, agreed to pay Oklahoma $270 million.
Okay. There was just something about Johnson & Johnson.
Yep, Johnson & Johnson too. And what they're comparing this to is the asbestos.
Oh.
So it is like asbestos and lead paint. You can't tell exactly where your opioids came from. If you're an addict, you don't know if you got your opioids from Johnson & Johnson or Purdue Pharma, just like when they discovered the problems with lead paint and went back in these houses, you didn't know if it was Sherwin-Williams or Bayer or whoever. So there's going to be billions of dollars, and multiple pharmaceutical companies are going to be held responsible, and it's a class action thing, and everybody's going to have to pony up.
It brought me joy to hear that Purdue Pharmaceuticals was going to cough up some money. More specifically, the Purdue family members are coming up with $3 billion of their own money, which sounds like a lot.
Mm-hmm.
But it's less than 25% of their net worth.
They made obscene amounts of money. I mean, I can't even imagine having $1 billion, let alone the $13 billion estate that they have. So, yeah, they're giving $3 billion, but it's still not going to hurt.
No, it's not going to hurt them much. Hopefully it makes them feel badly, and I hope they fight a lot. There you go. That's why I don't want them to have a pharmaceutical utopia. What's also interesting is that the pharmaceutical company that they own, Purdue Pharmaceuticals, has said if they cannot work out settlements individually with states, then they're just going to declare bankruptcy.
And that's what happened to the asbestos companies, too.
Yep.
Yep, that's where that comparison comes in.
I was going to say exactly that's what happened.
Purdue Pharma should go out of business.
Yeah.
But that's where the candidates agree. They also have taken a public health approach to the issue, emphasizing increased access to treatment. Efforts to crack down on heroin and illicit fentanyl trafficking haven't really been a central part of any of the campaign candidates' messaging. But not surprisingly, Elizabeth Warren has the most comprehensive, most thought-out plan. And it's been dubbed the CARE Act, based on the similarly named federal program to fight HIV/AIDS in the 90s. Her plan would pledge $100 billion to the crisis over the next 10 years. It's designed to cover all aspects of care, from prevention to harm reduction to support to keep people clean. Includes proposals to increase the number of treatment centers. And she proposes that this would be paid for through her wealth tax.
And I think it's also important to say in her plan is it to increase the number of treatment centers. It's to make sure that there are metrics regarding quality. So Bob's treatment center can't open up on a corner. And that's an issue right now with treatment centers. They're not all created equal, especially with the opioids. It's a very medically intensive process when it's done well.
Mm-hmm.
Again, Elizabeth Warren has a plan. I'm not surprised it's comprehensive.
That's why she's my favorite.
Amy Klobuchar also addressed it. And again, she's another planner. I still like her. And she approached it from mental health and addiction. There's a view that people are using these drugs to treat their mental health problems. The details are a bit fuzzy, but a lot of things are fuzzy on her website, as I found when I was doing research on her before. It isn't like she has a 14-point plan like Elizabeth Warren. In typical Klobuchar fashion, it's based on stuff that's already been worked through in Congress that has built some consensus already. There's nothing really radically new in anything that she's proposing, which is completely fitting in with who she is.
Mm-hmm. She does plan to fund it significantly with $100 billion proposal again. This is the part that I don't like is she wants to fund it from a tax on opioid prescriptions. But also from the pending opioid litigation. So I would like to pull the funding from increased taxes or the opioid litigation and eliminate that part about the tax on prescriptions.
Isn't that just buying into the concept that it's a sin tax, and if you're having pain, you should just pull yourself up by your bootstraps and breathe through it or whatever? I'm really troubled by that.
Exactly. I mean, it's one thing if it were cigarettes, which is still problematic, having the sin tax on that, but this is a medically necessary product for some people. So
she can bite me. Okay.
Kamala Harris also has a plan and focuses on the pharmaceutical industry's responsibility. She did introduce the Accountability and Opioid Advertising Act, which was intended to reduce misleading advertising and marketing tactics by opioid manufacturers. So that's really positive. However, it wasn't passed and it wasn't reintroduced in the 116th Congress.
Overall, I'm really impressed with her focus on going after pharmaceutical companies because that's where it all begins.
Right.
But I didn't really see a lot in terms of helping the victims.
She did introduce the Comprehensive Addiction Reform, Education, and Safety Act in 2018. I mean, I don't think it gets through.
I think her time as a prosecutor also has to come into play there. She went after people dealing in marijuana, for example, and stuff like that, and made her bones that way. And now she's kind of backed off from the war on drugs. And I get why she couldn't before if she wanted to remain electable. But the sand has shifted underneath her feet.
Right. That right there is my biggest problem with Kamala Harris. I think that she tries to be politically correct instead of standing by moral principles. I think she sways with where the wind is blowing, and that's a problem for me. Tulsi Gabbard. She co-sponsored a bill with Bernie Sanders called the Opioid Crisis Accountability Act in 2018, which again focuses on holding pharmaceutical companies responsible. The bill is from last year, and both of the candidates have spoken about the opioid issue since then, but nothing more recent or as comprehensive as this bill has been introduced. You can look at her website. She's got a page dedicated to the opioid epidemic and her record on the issue and her support for specific reforms.
And then we come to my favorite candidate of all time. Marianne Williamson, the person who, when I first watched her on stage, was clearly digesting an edible that was a little too high. She, unsurprisingly, supports decriminalizing drugs and increased access to 12-step programs in unusual places on TV or online. Again, I think a 12-step answer to the opioid crisis fits in with who she is, but doesn't fit in with current medical research.
Right. And it ignores
yes
that the most effective treatment for opioid addiction is that medically assisted treatment.
And this idea that you need to repair your spirit is also part of it. But for an opiate addict, I think you have to acknowledge that you can't breathe your way through it. You can't yoga your way out of this.
Right.
It's not trying to diss yoga, but you can't.
Right. I mean, most experts argue that we need a massive plan maintained for an extended period of time. And Elizabeth Warren has a 10-year plan, and Amy Klobuchar and Andrew Yang even has suggested massive funding increase. But that might be enough to confront the issue. Whatever we do, it's got to be big, and we can't just try it. Even 4 years isn't long enough.
Exactly. We also have systemic issues with access to medical care, and it is medical care, and we have access with how we view addicts as being lazy or useless, or they just need to toughen up. I do think Elizabeth's plan really addresses a lot of those issues, including funding. So we wouldn't be Feminist Utopia if we didn't have a call to action. That's kind of what we do here.
Right. Sometimes it's tougher than others, especially when we talked about how few resources there were for women. I'm familiar with one called Smart Recovery. It's not specifically for women, but it is scientific-based secular program that continuously updates its methods based on emerging scientific evidence in addiction recovery. So they're endorsed by organizations such as the National Institute on Drug Abuse and the American Academy of Family Physicians, and they're recognized as an effective tool. So you can check them out, and we will have the link in the show notes.
And I'm sure there are places like this in your local community. I'm going to talk about one here in Seattle called the Sophia Way. It is a not religious-based organization that focuses on helping women who are in homelessness, which means dealing with a lot of women who have addiction issues. They are very effective at getting women into treatment, which is a necessary goal because women, as we mentioned, don't end up in treatment very often. Not at the same rates as men, but they work on building trusting relationships with the encampment near my house, for example. They're out there at least once, twice a week trying to befriend these women so they trust them enough to come in and take advantage of the services that they offer. Different communities have different ones, and if you're interested in getting involved locally, I strongly suggest you looking for community organizations that work with women in homelessness. Thank you so much for joining us today at Feminist Utopia. If you like our work, please give us a review on iTunes, Stitcher, or wherever you access our podcasts so others can find us as well. You may also become a Feminist Utopia patron at patreon.com to show your appreciation. Patrons get perks. And check out our blog and other resources at our website, feministutopia.net. Things are always being added. Email us your idea of what a feminist utopia would look like or any questions to info@feministutopia.net. We appreciate you taking the time to listen and grow with us. Our sound engineer is Melody Kelly. Feminist Utopia is created by Debbie Williams and Benita Malone.